Hello and welcome to Nurse's Handbook. Today I bring to you some more points to remember which may help in your various nursing exams. First point to remember is opioid overdose. It leads to death. And how it leads to death? Because the opioid effects on the parts of the brain which regulates and controls the breathing. It has got a combination of 3 signs and symptoms, and they are A. Pinpoint pupil, second is unconsciousness, and the last one is the difficulty in breathing. Naloxone is an antidote to opioid poisoning. It reverses its effect if administered in time. Second is capnography. It is a non-invasive method of measuring the partial pressure of carbon dioxide during inspiration and expiration from the airway. Capnography provides physiologic information on ventilation, perfusion and metabolism, which is very important for the airway management. Capnography is the gold standard method for confirmation of the ET tube placement in the trachea. Third point is General Adaptation Syndrome, that is GAS. It is a 3-stage process which describes the physiological changes the body automatically goes through when it responds to stress. It was first developed by Hans Selye in 1963. It has got 3 stages, and they are: first, alarm reaction, second is the stage of resistance, and third the stage of exhaustion. Aspirin, it is also known as acetyl salicylic acid, and it works by reducing substances in the body that cause pain, fever and inflammation. It is recommended that it needs to be stopped 7 to 10 days before surgery to prevent the risk of surgical hemorrhage. Fifth point to remember is spironolactone, which is a potassium sparing diuretic, is used for treating fluid retention in patients with congestive heart failure, cirrhosis of liver, kidney disorder, treating hypertension, etc. Has got a major side effect, and that is it induces gynecomastia in males by decreasing the testosterone production. What is gynecomastia? It is a condition in which there is an overdevelopment or enlargement of the breast tissue in men or boys. Sixth point is choice of irrigant in TURP, that is transurethral resection of prostate, is 1.5% glycine. 1.5% glycine is a sterile, non-pyrogenic, hypotonic and non-electrolytic amino acid solution. It has an osmolarity of 200 milliosmol per liter. Glycine is non-conductive and its osmolarity minimizes the risk of intravascular hemolysis, and that is why it is a preferred choice of irrigant for TURP. 1.5% glycine is not used for injections by usual parenteral routes. 7th point to remember is a 1 cm tumor which is detectable by palpation contains 1 billion cancer cells. 8th point, xerostomia means dry mouth, and this is the main side effect of head and neck radiation therapy. 9th point, that is tumor lysis syndrome, is a condition which occurs when a large number of cancer cells die within a short period, releasing their contents into the blood. When cancer cells break down quickly in the blood, 4 hallmark signs are seen, and they are hyperuricemia, hyperphosphatemia, hyperkalemia and hypocalcemia. These changes in blood levels causes and affects the functioning of several organs, especially the kidneys, heart, brain, muscles and GI tract. 10th point to remember, that is caloric reflex test, which is also known as cold caloric test or the caloric stimulation, is a procedure which is used to find damage to the nerves in the ear, that is the acoustic nerve. It is performed by inserting first cold and then warm water into the ear canals, then the electrodes placed around the eyes measure the eye movement. This test is used to evaluate hearing loss caused by antibiotic use, vertigo, psychological causes of vertigo, and the brain damage in comatose individuals. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurses Handbook.